Each year, more than 600,000 hysterectomies are performed in the U.S. Hysterectomy, removal of a woman's uterus, is the second most common major surgery among women, the first being childbirth by cesarean section. About 1/3 of women in this country have had a hysterectomy by age 60.
We have two types of hysterectomy. We have total hysterectomy, which is removal of both the uterus and the cervix. And we have a subtotal hysterectomy or supracervical hysterectomy, where we're talking about just removing the uterus and we retain the cervix. The indications for hysterectomy are typically, again, for benign disease, for symptomatic uterine fibroids or very heavy vaginal bleeding, which is an extremely common symptom. Again, we have various options and treatments, but in certain situations, hysterectomy is still a necessary and beneficial procedure.
Dr. Michael Nemiroff is the Vice Chairman and Chief of Gynecology at North Shore University Hospital in Manhasset, New York, and an Assistant Professor of OB/GYN at the Hofstra North Shore LIJ School of Medicine. He says that while the vast majority of hysterectomies have been performed through invasive open surgery, technology is available to change that and also to decrease the number of hysterectomies. This is good news for both patients and surgeons.
Minimally invasive surgery is any procedure that we can do that avoids a major abdominal incision. And this has obviously tremendous advantage to the patient as far as recovery and return to normal functioning. So any procedure that we can do without a large incision, such as laparoscopic surgery, where we perform surgery through little incisions, very small incisions in the patient's abdomen. But also in gynecology, we have other procedures such as vaginal surgery or hysteroscopic surgery. Depending on the actual condition that we're treating, we have a various array of minimally invasive surgical options for patients.
Minimally invasive surgical techniques like laparoscopy have distinct benefits for the patient, like less scarring, less pain and blood loss, and quicker recovery time. But further advancements like single incision surgery and robotics are taking minimally invasive gynecological surgery to the next level. At the North Shore University Hospital and its specialized Katz Women's Hospital in Manhasset, New York, part of the North Shore LIJ health system, Dr. Nemiroff and his colleagues used the Da Vinci robot, which combines remotely operated robotic arms equipped with minute surgical instruments and 3D real-time imaging, giving them an increased level of precision, versatility, and control in intricate surgical procedures.
The robot is also used in other subspecialties of gynecology, mainly GYN oncology, where the gynecologic oncologist will use the robot for treating GYN cancers. And it's also useful by urogynecologists in treating genital prolapse and other urologic conditions that affect women.
Robotic instruments can do things traditional laparoscopic instruments cannot, like twist, turn, and maneuver around corners. In addition, the technology allows the surgeon to have a magnified 3D perspective that facilitates performing complex surgical procedures in a manner not done before.
The robotic instrumentation facilitates the surgeon when working deep in the pelvis, working with complex pathology such as endometriosis or removal of multiple fibroids, or for the GYN oncologist when they're dissecting and removing lymph nodes in tough areas of the pelvis. And it really facilitates performing these complex surgeries.
For many women, a hysterectomy is often associated with feelings of loss and emotional distress. The benefits of minimally invasive surgery translate into quicker physical healing, so patients can focus on emotional healing. Also, the robotic surgical technique avails more patients the option of the minimally invasive fertility-sparing surgery called myomectomy.
Typically, the surgery, from what I learned, was done with an open procedure. What I found with Dr. Nemiroff's technique using the Da Vinci robot is they were able to do this in a minimally invasive way where they can just put a few portal holes within your abdomen, and he can go in and do the surgery with the assist of the robot and pull out the tissue so that you would not need a large incision. You would then have a full recovery in a shorter amount of time. And the symptoms, I have to say, went away immediately. So overall, I think it was a huge success.
Minimally invasive surgical procedures have been around for nearly 2 decades, and clearly the benefits, both outcome and patient satisfaction, are extremely high. And it's really driven the market to that virtually every procedure today in every specialty is being performed and offered through a minimally invasive technique. Robotic surgery today, which is one of the newer forms of minimally invasive procedures, really today again offers more patients an opportunity of having a minimally invasive surgical procedure for their condition.
Dr. Nemiroff in his office told me that, spoke with me about it and said it would be a much quicker recovery time. I kind of didn't believe him. He said I could be back at work in 1 week, and that it was minimally invasive, and that it was safe, and that it was the latest procedure that's being done.
Women today have numerous surgical and non-surgical options to avoid hysterectomy in many cases. So patients who come in with a benign condition, we do have other options. Hysterectomy is sometimes still the right answer, but we still have other options, specifically for patients who are trying to preserve fertility. Myomectomy, a common operation where we remove the fibroids and repair the uterus, is certainly an option for many patients. And we have other procedures as well, such as uterine artery embolization, which is a procedure performed by radiologists for treatment of fibroids, as well as procedures such as endometrial ablation for treating heavy bleeding. And we also have some non-surgical treatments as well and conservative follow-up. So this is when you come into your physician, you have to discuss all the options.
The women's healthcare specialists at North Shore LIJ Katz Women's Hospital offer the most advanced state-of-the-art diagnostic and treatment tools available. Whether you are welcoming a new baby into your family or requiring advanced gynecological surgery, the North Shore LIJ Health System is here for you.
This is an exciting time to be a healthcare professional within the North Shore LIJ Health System. We have the opening of 2 brand new women's hospitals at both North Shore and LIJ called the Katz Women's Hospitals. And this is a hospital and a facility which is really established to meet the unique needs of women when they go through various stages of their life and medical conditions.
If you or a loved one has been diagnosed with a gynecological condition that requires surgery, you owe it to yourself to learn more about the benefits of the minimally invasive procedures that are available, including robotics. These state-of-the-art procedures position the North Shore LIJ Health System and its Katz Women's Hospitals as leaders in advanced gynecological treatment methods within the medical community. To learn more about minimally invasive surgical options for gynecologic conditions, visit us online or call 888-594-4343.